I'm Dr. Andrew Block from Texas Back Institute, and I'm a clinical health psychologist. I started working in a mental health center. Right after I graduated, I was a psych major undergraduate, and I worked in a mental health center. This was at Dartmouth College. Started what they called a behavioral medicine unit, which was a unit that treated primarily chronic pain and physically ill patients, and really enjoyed doing that. And that's really the place that I decided to pursue my career in psychology. Oh, well, I mean, Texas Back Institute, even in 1990, was already known as the premier spine facility in the United States, and I had been developing my procedures basically to do pre-surgical evaluation of spine surgery patients to see how well they might do as a result of spine surgery with this group in Indianapolis. And when I came here, Dr. Hochschuler and Geyer and Rashbaum were all here, and they really encouraged me both to do the research and my clinical practice. And that's really what I wanted to do, was not just see patients, but to be able to pursue my research and writing. And really, they've encouraged me all along in that. And this is really a unique place. Most of the research that's done in the United States in medicine, of course, is done in academic medical centers. And to have a group of private practice doctors be so committed to research, it's just a wonderful opportunity for me. And they've always been very supportive of my trying to explore further psychological aspects of spine problems and of pain. So it's been a perfect fit for me, really. I really enjoy hiking and going to national parks, and here we have the Arbor Hills Nature Center just about a mile away from here, which is also a really unusual park for a metropolitan area. Lots of hills and trails through the woods and creeks, and go out there almost every day with my dogs. And the other thing I do is I play mandolin, and although I'm way out of practice right now because I've been so busy with doing everything else, but that's sort of my other hobby is the mandolin. The legacy that I've really pursued, and I think hopefully will remain, is to do what's really now becoming quite important in medicine, which is to look at the whole person in a medical practice. It's now called integrated care, where psychological evaluation and treatment's embedded within the medical practice of patients who have complicated and sometimes even uncomplicated medical conditions. I would hope that my legacy would really be to stress the importance of that and to provide some direction and some consistency in the ways that those evaluations are performed, so that they're based on research, not just on kind of the global impression a psychologist has, and that they really are helpful to physicians in determining the direction of treatment they should take, and so they can build on the patient's strengths and kind of minimize whatever vulnerabilities they might have to not get a good outcome.